Kristen with also Urogynecology. I'm one of the nurse practitioners that works with Dr. Joshua.
And I'm Marcy. I'm one of the medical assistants here.
And we were just kind of getting together and discussing some common questions that labiaplasty patients have. And we're just going to kind of pose some scenarios that we often hear from patient calls. We also work very closely with Real Self and answer questions that patients pose through their Real Self accounts. And so this will kind of be some of those scenarios that we commonly see or hear.
Exactly. So one of our first scenarios, and what we see a lot and get questions a lot about, so a labiaplasty patient is about 1 week post-op. She's not sure if her incision line's healing well, and she's having a lot of swelling. So what should she do?
Okay. So a lot of times for our post-op patients, we will, if we're concerned about something, typically have them upload a photo. Every surgeon's going to be a little bit different in how they kind of care for these patients. But in general, I would tell most patients, you go through a very a phase of the labiaplasty healing process where when you look down at the labia, you definitely would be kind of worried that if that was the outcome that, you might not be happy with that. But it's only in the initial kind of healing phases that you see that. During that phase, you're going to have a lot of swelling, a lot of bruising. You may have a little bit of crusting along the incision line, and all of that is normal. We do typically tell patients if they're having increased pain, increased bleeding, anything like that, that they definitely want to give us a call or their surgeon a call if we're not following them. And then, usually through just kind of talking to a patient, you can get a better idea of exactly what's going on and kind of reassure them. Because a lot of times in the first few weeks, really most patients just need some reassurance.
Okay, and then so with that, what would one consider as increase in bleeding?
Okay, so post-operatively for our patients, we typically do tell them that you're going to have some bleeding that can be similar to a period for the first few days, and that will typically lighten up within that first week to 2 weeks. You are going to have some spotting and things like that over that time frame, and the spotting can actually even persist longer than that if you still have sutures in place. But we do tell patients for the first week you want to wear a pad or something a little heavier than just like a standard liner, and then after that, you can switch over to a liner. The heavier bleeding that we would be concerned about is if all of a sudden you started noticing an increase in bleeding, or you're soaking through pads like hourly or something like that, which would be, I would say that would be a very, very rare occasion, and if that were occurring, that would warrant either a visit to your surgeon's office or a visit to the ER.
Okay. And then also with the post-operative period, so cleaning wise, is it okay to apply soap? Should I just do water? What should the post-operative cleaning method be?
Okay. So we've we've changed our cleaning process for patients post-operatively, mostly from to decrease infection risk. Post-operatively, it's going to be sore. Patients are going to be very hesitant to kind of clean in the area just because of that discomfort. But it's very important post-operatively to apply soap in that area just to make sure you decrease the buildup of dead skin in that area, and also if there's any dried blood, that you get all of that cleaned off in the area as well. And then the main thing that you want to make sure when you're using soap in that area is that the last thing you do is have water touch the area so that you ensure that there is no soap left on the incision line.
That makes sense. And so earlier you mentioned there might be a little crusting here and there. Should I be alarmed if it's an infection, or are there any red flags that I might think that it is an infection and call the office?
Yeah, so infections are actually pretty, the risk of infection is actually pretty low with labiaplasty procedures. Believe it or not, I think kind of in our mind, we think it's a warm, moist environment, so you obviously think that, okay, that's going to be kind of a high risk for infection, but in fact, we rarely see infections within the labiaplasty patients. The crusting along the incision line sometimes is just your body's process of healing the area. And typically what we see when there are labia infections is that usually it doesn't even present as a normal infection would. You're most likely not going to get a lot of pus, a lot of kind of redness or swelling and things like that. Most commonly when we see infections within the labiaplasty patients, it's the incision line will look perfectly normal, and everything looks as if it's healing well, but then there's an isolated area of localized pain, or they've noticed kind of out of nowhere they just have this new onset of pain in a very localized area. And usually in those patients, we will go ahead and treat. And that treatment is usually just with a short course of oral antibiotics.
Okay. And then, so if I do notice some sutures falling out about 2 to 3 weeks post-operatively, is that normal?
So typically the type of sutures that we use, and I would say it's probably pretty standard for most surgeons, they typically will use like a dissolvable, absorbable suture, one that does not have to be removed. Occasionally, we will remove sutures if they're bothersome for patients. But we usually will tell most patients that they're going to take typically 4 to 6 weeks, but you may notice some sutures falling out before then. Now, when you would be concerned, or where you would probably want to see your surgeon, is if you start to notice like incision line kind of breakdown, where the sutures are falling out and you're noticing that the skin is separating along the incision lines. Most of the time, even if you do have an incision line separation, that area will heal fine and you'll never even know that the separation occurred. But you definitely want to let your surgeon know if that does come up.
Thank you. Do you have any more tips or advice or places on our website?
Yeah, so definitely if you'll go into Austin labiaplasty, gosh, I forgot our website.
ALBI?
So on our website, we have a lot of information regarding vaginal rejuvenation, as well as labiaplasty procedures and kind of all of our particular offerings. We do have frequently asked questions on there as well, and that may include some of the stuff we went over today. But we're always happy to answer any questions that patients do have, whether there are patients, potential patients, anything like that. And you can ask those questions through our website.
Awesome. Thanks, Kristen.
Okay, thanks, Marcy. Thanks, guys.